So today's topic or session is about clinical teachings or bedside methods of clinical teaching. So all of you know about what is clinical methods, bedside teaching, as all of you are postgraduates and you undergone the internship in postgraduates. Also, you have done the hospital duties. So clinical method of teachings or bedside teachings are very
Yes,
crucial
Arvind.
related field. Hello. So medical related field. So all of us are undergo this type of method. All of we are undergone this method of learning in our course, but we don't know about what is the exact meaning, what is the theoretical aspect, concept behind this clinical methods and bedside teaching. So today we will learn what are the things, concept, why bedside teachings are important in our course, especially related to medical field. So first slide. So in clinical teaching, BAMS is a professional practice discipline. Whether it may be BAMS or MBBS, BHMS, any medical related field like nursing, even nursing also. So these are practical discipline periods. So after the completing the course, the students are ready to practice whatever they learn in their course. So what students do in clinical practice is more important than what they demonstrate in the classroom. So classroom demonstration is important, good, but the ultimate aim or objective of these courses or professional courses is, so in clinical practice, how much they are able to do whatever they learn in the classroom. That is the important. So that's why this clinical learning activities provides the real life experiences and opportunity for the transfer of knowledge to practical situation. Clinical learning activity will help the students to it provides the students to real life experience what exactly happens in the patients persons. That real life experience will be available from the this clinical side, clinical teaching or bedside teaching, and transfer of knowledge of theory to practical situation. We learn the theory in the classroom, so application of that theory into practically in the patient, this bedside teaching or clinical teaching is helpful for the transfer of theoretical knowledge into practical field. As we observe that some students or some learners, they are not able to apply their theory knowledge in the practical. They are well in the classroom, they are telling the concepts in detail clearly, but when it comes to the practical field or practical clinical area, they are not successful in the applying whatever they learn in the classroom. So to overcome this problem, if in that particular institution or college, if clinical teaching methods are good, then good then the learner or student is able to apply their theoretical knowledge in the practical scenario. Hence, it is responsibility of the institution render quality medical education through sound clinical teaching programs. It is the responsibility of the institution. It should provide the adequate training in the clinical side teaching or bedside training for the medical graduate. So another important thing is, when students are actively involved in their learning and pursue a positive teacher-student relationship, they can honest be about their learning needs and how faculty can help them in the developing their clinical computation. The learners should honest to about their learning, and they what should they learn, what how should I examine, how should I treat the patient. They should have the positive relationship with the teacher. Teacher in a theory classroom, the relationship between teacher and student is something different. In practical when we are dealing with the patient in the wards, then the relationship is positive, means it comes more understanding and positive attitudes in between the teacher and student relationship. In the theory class, if student is not listening, he may read after the class and he may understand. But in bedside teaching, it is more important between the relationship of the teacher and student. Then the faculty or teacher will identify the what is the need of these students. So based on their needs, the faculty should help them developing the clinical competencies. And clinical practice requires critical thinking and problem solving abilities, specialized psychomotor and technological skills, and professional value system. So in in theoretical class, if you are attentive, if you are listening the concept, you can able to understand the concept. But in clinical practice, it need thinking, critical thinking, problem solving abilities, and specialized psychomotor and technological skills. So as you know that this three domains, cognitive and affective and psychomotor domain. So because here we are learning skills, our psychomotor domain should be properly utilized. So that's why in clinical method of teaching, the all things will mix and all the domains will activate. So if someone is cognitive level domain or cognitive level is good, but his skills are not good, then it is not useful. So clinical practice requires all the domains or all the attention from psychomotor and skill, because they are learning not only theoretical aspect, they are also learning the skills. So practice in clinical settings exposes students to realities of professional practice that cannot be conveyed by textbook or a simulation. So in theory class, we can't explain what are the real problems comes when we sit in the OPD, when we see the patients. Some situations, some scenarios, they are not understood when we are telling in the theoretical classes, or we also not able to explain what are the problems, what are the certain things happen in the when we really practice that type of messages, that type of problems, realities we can easily convey in clinical settings. So students to realities of professional practice that cannot be conveyed by a textbook or a simulation. Simulation means artificial situation, or by simulation or by theoretical classes we can't tell the realities of professional practice. In clinical settings, you may expose the student for what are the real problems, what are the challenges in the practice, in the clinical method of teachings. The clinical teaching must include skills such as identify the knowledge gaps, finding and utilizing newer information, and initiating or managing the change. So what this means that in clinical teaching includes skills such as identifying the knowledge gaps. What is knowledge gap? Certain diseases, certain conditions, even in textbook also, they have not mentioned properly, or certain things they are not there in our curriculum. So that type of knowledge gap we can fill in the clinical methods. Certain things, certain knowledge informations are not available in the textbook or our literature. In practical scenario, we may know that gaps, what are the gaps in the knowledge. So we can identify and finding and utilizing the new information and initiating or managing change. Because of advancement of research in science, so newer concept, newer things will are arranging from day to day. So what are the newer things, new information, how to manage that particular change, conditions, newer diagnostic test, interpretation, newer modes of treatment. So everything we can teach in the clinical methods. So in addition, healthcare professional usually practice in interdisciplinary settings. In this means interdisciplinary setting means we can work in the medical medicine department, surgery department. So interdisciplinary settings, the student or learner will usually practice. That's why it is benefit for to understand the all the practical aspect in the clinical methods. Then students must learn teamwork and collaboration skills. Faculty members should allow plentiful learning time with ample of opportunity for feedback before evaluating the student performance completely. So students also learn teamwork and collaboration skills. So in internship, they will make the certain batches or groups. Then in clinical method or bedside teaching, the teamwork and collaborative skills also develop in the learners. So to learn these things, the faculty or teacher should give the sufficient time for the learners. After that only the evaluation should be done, evaluating the student performance comparatively. Comparatively means before posting in the particular department of medicine or surgery, before posting and after the 2 months of posting. So what is the difference in the behavior and attitude knowledge skill in the that particular learner? Then only we can evaluate. So that's why in evaluation in clinical methods, the faculty should give the time, proper time with ample of opportunity for feedback before the evaluating student performance comparatively, because that learning method is different. That time the patient should be there, the adequate opportunity to learn that certain things should be there with learners. That why to evaluate in the practical knowledge we give some time and a number of opportunity to learn the learners. Then meaning and purpose. Meaning means the clinical teaching is a teaching learning experience of the students in a clinical setting. In a traditional classroom, we are this teaching learning process is happening in the classroom, generally in the classroom. But in clinical teaching is happening in these clinical settings, fields such as hospitals, clinics, community health centers, etc. So the place is entirely different for teaching learning process. Clinical teaching is planned by the tutorials, lecturers, colleges, organized and implemented by the clinical instructor who accompany the students in the clinical settings. It is planned by the teachers, lecturers and academic department who will be there with students. So who is the instructor? So everything will be planned by the this teachers, lecturers and institute. So various other members of health team are also take part in the clinical teaching program. So usually in bedside teaching, sometimes we are talking about whole medical field in general. In certain fields, there may be a doctor or a consultant, specialist, and along with him the pharmacist, nurse. So other members are also there in the clinical teaching methods. That is ward sister, staff nurse, dietitian, physiotherapist, etc. Also assemble and also they are part in the clinical teaching programs like doctor programs. For example, if you go to the Panchakarma department, Panchakarma therapy. So along with our Panchakarma faculty or teacher, usually the therapist is also explains some things how we will do Abhyanga. Practically what he is doing, he will explain. So in wards, how the nurse sisters, they will give the medicines, how they will maintain records. So number of other faculties can also join and they are also part of this clinical method. So purpose of clinical teaching. A well-planned clinical teaching programs make valuable contribution in the education and training in the medical student. The clinical teaching, clinical method should be well-planned. It provides opportunity to student for the following. That is, gain knowledge through study and experiences. Both observation and experiences he will seeing the cases, he will gain the knowledge and experiences in the clinical teaching. Apply the knowledge in the clinical setting. Whatever knowledge he know, how he may apply in the that knowledge in the clinical setting, and acquire desire, attitude, and values in the giving medical care. Then develop skill needs practice art of treatment in the variety of situation. So the skill will be developed to practice in the variety of situations. So these all are the purposes of clinical teaching. Why we are posting in the clinical side. That is, these are the purposes to achieve in the clinical teaching. So factors which influence the clinical teaching. Clinical teaching is important for creating and maintaining a climate of mutual trust, respect that supports learning and student growth. Mutual respect means the both teacher and learner, consultant and that internee. So faculty members must respect students as a learners and trust their motivation and commitment to the profession. If this not happens in the clinical setting, then it affects the it influence the teaching learning in the clinical bedside. If the instructor or consultant, they know the what are the need and what are the motivation, what are the interest in these learners, based on that the clinical teaching will go. You may observe in the internship certain batches, certain groups with certain instructor or professor, they will teach based on their interest in the that particular group, motivation of that particular group. Based on that, the instruction or teacher will teach the clinical methods or things. So it depends on the mutual trust and respect. If you don't show interest in the clinical method or bedside, the instructor is also not much interested. But in theory classes, even he will force or he will do some more extra work to understand you, if even though you don't have interest, or he may for your improvisation he may do extra effort, teachers. But in clinical methods, it majorly depends on the trust and mutual respect and your interest in the learning the bedside or clinical methods. So these factors influence in the clinical teaching methods. Then students must respect faculty's commitment to both medical education and society. Students also have responsibility, they should respect the faculty's commitment, and what is the social society faculty members who will treat them fairness, ensure that students do not make mistake that would harm patients. It means so they are also aware when in clinical bedside, the faculty should give this proper instruction or taken care should be taken. The mistakes done by the internees or trainee doctors should not harm the patients. Then characteristic of a teacher and learner. These factors will influence in the clinical methods and clinical environment and nature of practice within the that environment. The environment and nature of practice means how much patients will be there, how the environment is there in that hospital. So nature practice within that setup, that environments, that setup, number of patients, different kinds of diseases patients. So everything matters. Based on that also the learning clinical method learning will influence. If no patients are there, no proper facilities are there, so there is no proper clinical teaching will happen in that institution or that particular place. Patients, family, and other whom students are caring. Sometimes the patients are very helpful when we go bedside. They are very supportive. In some condition, some situation, the patients are uncooperative. So this clinical methods learning also depends on the patients, their families, and others whom students are caring. The policies of agency and the value of people hold regard to the clinical teaching. Certain policies, rules, regulations also will influence in the clinical side, uh, teaching or learning in the clinical side. So certain rules, policies will be there in particular hospitals, limitations for the giving the medicines, asking. So certain policies of that particular place or hospital also influences the clinical teaching process. Then actually how this clinical teaching process will happen. So it will be step by step. Also, first identify the outcomes of learning. So first instructor or teacher or consultant should identify what are the objectives. After this uh, clinical side practical, what should the outcome of the learner? Though in area of clinical posting, the behavioral outcome in terms of knowledge, skills, and attitude should be clearly specified in discussed with students. So all the three, knowledge, skill, and attitude should be, what are the changes in the knowledge, skills, attitude should be clearly identified before going to the bedside cleaning. So after this class, you should know about this disease, you have the skill of diagnosing this and change of attitude towards that particular situation. So all these should be behavioral outcome in terms of knowledge, skills, attitude should be clearly specified and discussed with the students. You can tell the students, after this class, you are able to diagnose the Kamala. You are able to to know the more knowledge about Kamala disease, and you have skills to how to palpate the liver, how to diagnose the Kamala patients, and the attitude towards that patients, how to care, how to give the supports, how to ask. So these type of changes will, these type of outcomes will happen in the students. You should tell in the students before going to the bedside. Then assessing the learning needs. So how much need is there for, if the learning needs the students individually and group should be identified by the clinical area according to the level of education. Level of education means whether the students are undergraduates, postgraduates, or nursing student or other paramedical student. Based on their level of education, their need, how much actually they need for practical purpose. So assessing the learner's needs and the level of theoretical understanding and practical skills are continuously assessed by working with the students in order to understand the areas of strength and weakness. First, you have to assess the what is the level of education and how much need is there, how much depth should be it for that particular group. Specialties, postgraduate students are there, a deeper and extra things should be told on undergraduate level, that level of based on education, the methods will be changes and knowledge or inputs will be changes. So first, if the for understanding undergraduate student or second year student, second BMS student, if you are explaining more in detail and even treatment and prognosis, so that will be burden for that students. That's why to know the level of education and need of the students before starting the clinical teaching process. So first one is identify the outcomes of learning, then assess the learning needs, then the level of theoretical understanding of the students, how much they have understood theoretically, and practical skills are continuously assessed by working with the students. Then continuously we are in bedside teaching, we will assess their theoretical knowledge and practical skills working with that students in order to understand the areas of strength and weakness. So when we go through bedside teaching, the teacher will assess what are the weakness, what are the lacunas, where is the problem, theoretical knowledge, practical knowledge. He will know when we are continuously go under this clinical teaching process or bedside teaching. If we ask any question, how to conduct this nervous system examination, if students are unable to answer, then he may think that the theoretical understanding is also not good for this particular area. So like that, the assessment should be done by the continuously with students in order to understand the areas of strength. What is the strength and weakness of this particular learners or group of learners, we can understand. Then planning clinical learning activities. So clinical learning activities are planned according to the objectives and individual needs. Clinical learning experiences are provided through variety of case assignments and assigning other responsibility. Then plan for the activities. Then planning should be according to individual need or the academic objectives. And variety of case assignments and assigning other responsibilities should be given. This particular batch should take the case history. This particular batch should do the general examination. This particular batch should do the planning for the treatment. So like that, different type of assignments will be given, and different cases will be assigned, and a particular responsibility will be given to the learners. Then if all the students, all the internees get taking the history only, then the other things will not go. So it is assigning the responsibility and other things in the planning in the clinical learning activities. Then guiding learners in the clinical practice. So all students need guidance and assistance, but the amount of guidance required vary from student to student. Student to student vary hota hai, because some will very sharp, they will understand in very easily, and some persons will need more guidance or more observation from the teacher. The clinical supervisor should able to recognize who needs supervision and who should not left carry out the care. So based on learner, based on the confidence on you, the teacher will leave you alone in the bedside, or he may do complete supervision. So based on the his level of training and his ability, the supervisor should be able to recognize who needs supervision. It depends on individual to individual student. Some students are very sharp and skilled, they are do well. Some students need the constant training and supervision vision in the clinical methods. All of you who gone through this bedside teaching, so you can easily imagine with this explanation what are the things usually happens in the bedside teaching. You are easily understand. This is not that much complex topic. By simple explanation, you can imagine what are the things, but you don't know concept or theory behind what we done in the internship postgraduate level. So that's concept we are learning. So next, evaluating the clinical learning and performance. The supervisor should carry out formative and summative evaluation in the each area of clinical experience. So here also the evaluation is in the form of formative and summative evaluation. For a formative का मतलब क्या होता है in clinical method? If first the teacher or consultant will teach the how to examine the abdomen examine. The next practical session, he will ask, check, do the abdominal examination first. So that is formative. Immediately he will check for the learning of the learners. That is formative. Summative means after the end of the internship or after the end of the final year in practical session, in practical bedside practicals, he may ask the do the examination. That is summative evaluation. Summative means at the end. So that's why even after the internship also, to evaluate the training of the students, the government has taking the which exam? Next exam. So next exam will be based on practical knowledge, practical skills, practical oriented. To evaluate these things, after the internship, they have given the next exam. After the final year, you will take the final year examination and you go to the internship. In internship, how much they are practically learned, how much they are efficient, to measure, to evaluate that, the government is conducting next exam. That is the thing. That is the summative evaluation. By monitoring and giving constructive feedback so that students are motivated to achieve the clinical learning objective. That is the motto behind the conducting the next exam. So this is the process, how steps in the clinical teaching methods. First, identify the outcomes of the learning, then assessing the learning, then planning clinical learning activities, guiding the learners in clinical practice needs, and evaluating the clinical learning performance. This will go in this step only. You should know the theory behind this. So the questions may ask based on this sequence also. In the clinical method, first, what should we do? This is the first step. So you have to remember these steps in the clinical teaching process. In your practice also, for clinical department, to students, you may in your teaching, you may also adopt these steps. First, you have to identify outcomes of that particular clinical side class, then you assess the learning, then these type of step even you practically apply, that are more beneficial. Then factors influencing the selection of clinical assignment. So which type of clinical assignments will given to the students? It depends or it influences by the number of factors. First, each clinical activity should be integral part of the course and educational program. You should assign the work or assign the that clinical assignment. It should be integral part of the course. Without that part of course, out of course, or we should not assign that things. For example, you may tell the examination of the general examination, systemic examination, treatment, what is there in the our subject, but you should not tell that do the particular things that are not covered under the our course or our system. So we may not uh, tell that the out of integral part of the course. That is the concept. Then educational, then it is essential that the instructor, student, staff members understand the goals of each clinical activity. Learning activities are selected and structured so that they are logically, sequentially objective. Objective should be fulfilled, then logically and sequentially the assignment should be given. The first important fact is the whatever assignment you give, it should be integral part of the course. So what are the things are there? It may be vast, different on condition, different on subject. It may vary different on state's law also. So it may vary. For example, in ascites patients, whatever things in our Ayurvedic hospital, you can do only that things. If other procedures, other things are for tapping, if there is a permission in that, so you can assign that work also for the students or postgraduates in clinical methods. If otherwise, you can take the help of the other modern stuff. So it depends on the things, and certain limitations also there in internships. Even though we are posted in the Shalya department, so we are limited to certain procedures and certain level of things. Beyond that, we will not assign the things to the internship student. So in postgraduate level, the requirement is high, and high level assignment we can give. It depends on the part of the course. That is the important. The need, interest, and abilities of the learners. So what is the need, what is the interest, and what is the education level, previous experience to that clinical situation or method, aptitude of learning, learning style, specific needs, abilities should also influence the selection of clinical assignments. Based on these, also we can give the assignments or different work in the clinical level. So if we students education level, a previous experience, we can move the further higher level. If students or learner don't have the basic concept also, then we will start from the basic things, how to take case history of from basic, after that examination, after that treatment. So it all depends on the learners, learning aptitude, experience, previous education level, everything. The learners do not have same needs, so that unreasonable to accept them have to same learning assignment on any given day. So all learners do not have same needs, because some already know about the particular condition, particular disease. They have previous experience from other places. If someone is doing the work in the hospital, he may know he may have the previous experience. So based on these things, we give the different assignment to the learners, and students who are able to achieve the objectives of essential curriculum quickly might receive assignments from the enrichment curriculum that allows them to focus on their individual needs. So curriculum का objective, what are the curriculum needs, that type of assignments if you give, they may receive, then that will help for the achieve that curriculum objectives easily and focus on their individual needs also. That is the importance. Needs of patients also important. The factors, assignments, if patient needs and care requirement is also important to giving assignments or assigning the particular work in the clinical methods. If patient needs and care requirements should also be considered when planning the clinical assessment. If you are giving the assignment, do the Abhyanga or Abhyanga to particular patient, but the patient does not need Abhyanga for that particular condition, that is also influences the assigned patient needs. Patient does not need Abhyanga, but if you assign this, do Abhyanga for this or examine the, for example, any patient suffering from particular disease, if you are giving the assignment in that patient, that is actually not need for that patient. That is also you should keep in the mind. That is the thing in the that the factor also influence the assigning the clinical. For example, sometimes if you um, want to examine the particular things or particular system related problems, so you may that patients also need the detailed examination for that particular disease or his condition, then only that will be effective. If patient does not need that care, then it should not be given in the clinical assessment assignment. That is also influencing the clinical methods. The medical care activities required by the patient may not present enough to challenge one learner or may too complex for the another. So sometimes the patient need is challenge for the some students, and it is very easy for the some. It may different because it will takes the different type of treatment methods. So that's why the assignment for learners will be, some may not present enough of challenge to one, and it may be complex for the other. It depends on the his previous experience and knowledge and other things. Patients wishes regarding the students assignment should be respected. If anything given to the students, that patient should if patient don't want that particular internee or trainee doctor, or if I have assigned give IM injection to the patient, give this IM injection, TT injection before surgery or before Char Sutra. If the doctor tells the give the TT injection to the patient, if patient rejects, patients also if rejects, if patient not want to take injection from learning or this trainee doctor, then we have to respect his view regarding the student assignment should be respected. We can't force the patients. That is the importance in the clinical methods. If against patients feel, if you do anything, then it may lead the other problems. So it is important. Patient wish or patient opinion is also important. And nursing staff members who have provided to care to this patient can often help the clinical teacher determine if student learning needs and specific patients and family needs both can be met through the particular clinical assessment. It all depends on these things also. Nursing staff members, the family members accompanying with these patients. In thesis, particular clinical research, if patient is cooperative, if you take any particular disease for your thesis or research, then these all things you are experienced already. The staff, how they are uh, providing care to patients, and the clinical teacher it determines the learning needs, specific patient family needs. So everything should be considered before assigning the this clinical assignment in the bedside. So it is a very comprehensive or overall observation should be there. Simply if the patient is having disease and we can't assign the that patient to the learner, these other things also we should know about the whether a patient need that particular thing, or the patient is willing, or the particular family members are willing to that particular assigning the students to care of that patient, doing the procedure. Everything matters in the clinical side. Then timing, availability, and variety of learning opportunity in the clinical environment. Factors that will also affecting the selection of clinical assignment timing and availability of learning opportunity. Ideally, clinical learning activities are scheduled concurrently with the relevant classroom content. So if Ideally, what happens if in theory class, uh, for any neurological related disease discussion has happened. So ideally, after this neurological disease discussion, we have to see the patient related to this neurological diseases, like then only it may helpful, but it may practically not helpful if you are teaching neuro disorders in the theory class. That time the sufficient patients will not available in the hospital or anything. So ideally, if you teach in the theory and if you apply that relevant classroom content into the concurrent schedule, so if you in this week you have teach the neuro disorders, in next week in practical session, bedside session, if you conduct the neurological disease examination treatment, then it is helpful. That is the concept of the uh, mm, concurrently doing the theory and practical session. But it may sometimes difficult, but it is ideal. The usual schedule of activities in clinical faculty may determine the optimum timing of learning activities. Some clinical settings are available both to patients and students only at a certain times. So some particular days, particular time, patients are available in more number. In particular season, particular time, that there are less patients. So depend on certain times, the peak of patient number of cases will increase and decrease. So this also matters in the clinical methods. So particular type of disease will be disease patient will be more in that particular month. So in that time, that particular conditions will be suitable for clinical methods. So this depends on certain times. In other settings, however, scheduling clinical learning assignment during evening or night hours on weekend hours provides better opportunity to meet the objectives. Alternative for making clinical assessment includes the selection of teacher, learner, focus particular skills, integrative patient care, and various students. If you want to learn the Omana procedure, so in throughout year, we don't have same number of patients. It will depends on the month's time. And if you want to learn the Vamana practically, you want to go in the early morning. So time also depends. That is the concept of this particular sentence. Schedule. If you want to conduct the Vamana and Panchakarma, you have to go early mornings. That is the concept. So different time. See this. In other settings, clinical learning assessment during evening or night hours on weekends provides the better opportunities. So timing is important. In whichever time the availability is there, that time you should assign the clinical methods. Clinical teaching methods. So what are the clinical teaching methods of that related to objectives to appropriate to student level of knowledge, skill, and challenging enough to motivate the learning? Based on the knowledge, skill, challenging to motivate the learning, the proper method should be taken in the clinical teaching methods. What are the methods in the clinical teaching methods? So some of the important and commonly used clinical teaching methods include the following. First one is bedside clinic, case method and case study, nursing process learning, nursing care plans, care analysis, demonstration, ward rounds, logbook, drug file, records and reports. These all things constitute the clinical methods. These are the different methods to conduct the clinical teaching or clinical methods. Bedside clinic is one among them clinical teaching methods. Bedside clinic means we learn in detail one by one. These are the methods in the clinical methods. Clinical teaching methods include the following. Bedside, it may be bedside clinic, giving the case study, giving the case method, giving the nursing care plans. Usually it will be happens in the nursing education, care analysis, demonstration, ward rounds, logbook, drug file, records and reports. These are the different methods in the clinical teaching process. So what is the bedside clinic? Usually most of the clinical methods will happen in the are done in the this method only, bedside clinics. Majority of clinical teaching will happen in the bedside clinics. It is the method of clinical teaching where patient medical history and therapy used is discussed, followed by identification of patient's problem, It provides opportunity to expose the learners to the body of knowledge and skills cannot be taught in the classroom. Before conducting bedside clinic, patient consent should be informed and patient consent should be taken. This is the common method in clinical teaching methods. Teaching, bedside clinics, what we do, that is the most common clinical method. Usually it will use the knowledge of taking medical history, disease diagnosis, followed by the treatment planning. So before going to the bedside clinic, the patients and attenders consent should be taken. Oral consent, maybe we will ask the patient so it will be taken the consent for the before going to the bedside. Then advantages of learning through bedside clinics are given below. All of you know that this is presence of patient. Bedside clinic will do with in the presence of patient. Exact real patient के सामने real patient के साथ we will do the bedside clinic. So presence of patient and patient's participation strengthens the learning possibilities. Now, as opposed to the listening to a presentation or reading from a blackboard. क्लासरूम टीचिंग से पेशेंट ऐसे रहते, पेशेंट ऐसे दिखता है, पेशेंट का प्रॉब्लम ये रहते है, ये लिसन सुनने से ज्यादा पेशेंट के साथ हम टीच करते हैं ना बेड साइड टीचिंग, दैट इज मोर effective. In the presence of patient, if you explain that particular condition, you will learn, that will strengthen the learning possibilities. That is the importance of this bedside clinic. Learners have opportunity to use nearly all their senses: hearing, vision, smell, touch. For example, if you tell that this a particular wound smells like this, and if you go to the gangrene patient, see the gangrene patient, that particular peculiar smell will be you will remember throughout your life. So that type all senses will be utilized in the bedside clinical. You will touch the that particular skin conditions, how it texture will be there, how the changes will happen, and vision you will see the what are the changes, and you will hear in the abnormal lung sound. So all senses will work and you will perceive the knowledge through all senses. Knowledge through all senses. That is the importance of bedside clinic. All senses will be utilized here to learn more about the patient and their problems. These characteristics alone can help the learner remember clinical situation. If you see the patient real scenario in bedside, then you will remember it for whole life. In your practice also, if you see that type of patient, you will remember, yes, this is the this case, this is the this type, because you will learn from all, you are using all senses. You are not just hearing in the class, you have seen the patient, you have touched the patient, so every senses will perceive that particular concept. That's why it is more remembered and most useful in the clinical situation. So we are sure that you might able to vivid recall patient as you saw early in your training. Patient admitted with diabetic ketoacidosis, fruity smell of breath, ear languor, kusumal respiration, decreased skin turgor. If I am simply telling the skin turgor will be loose, tight, you may not understood. But clinically, practically, if you do the skin turgor, check the skin turgor, and in ketoacidosis, the fruity smell of breath will be there. By listening, you may not able to understand. If you really see the diabetic ketoacidosis patient, the smell of that particular breath of that patient, you will not forget throughout life. Smell of this different type of wounds and appearance of different types of patients, different sounds, wheezing sounds, crackle. So these type of practically, if we are using all the senses and we are learning in the bedside uh, teaching, that is why it is more important in the medical field, bedside teaching. Then bedside clinic is an excellent method to teach history taking and physical examination skill. Additional skill that is often neglected is observation. So history taking we will do and physical examination we will do. But sometimes we will neglect the observation. We don't observe the patient's behavior, attitude, what are the other changes. So you have to observe patient. What are the physical changes, mental changes. So we generally we don't know the do the observation properly. So observation is also important thing in the bedside. That is the concept. And important clues of the patient's illness, disease, response to the hospital is may often observed during the bedside clinic. So why this particular patient suffering or from this disease, this illness, and response after the hospitalizing, what is his response, what is his opinion. So everything you can learn in the bedside clinic. Bedside clinic is more effective and efficient when done with the specific purpose in the mind. Without purpose, if you are simply teaching the clinical side, teaching it is not useful. It is important to maintain a comfortable environment. All participants, the patient comfort is vital consideration. If you are teaching the cancer patient, the students, the participants, care is also important. Moreover, the patient comfort should be vital. If patient is not feeling comfort, distress, then you should not conduct the bedside clinic. That is the importance in the bedside clinic. Comfortable environment should be there. Then bedside visit. Bedside visit is not place for pointed questioning or criticism the learners. If any question you ask to the students, if student not answered, then it is not a place of criticizing or बच्चों को क्रिटिसाइज करने में, बोलने में ये जगह नहीं है. पेशेंट के सामने हम बच्चों को कुछ क्रिटिसाइज नहीं करना है. So that is the importance in the clinical method or bedside teaching. You have to remember, patient के सामने किसी को भी कुछ नहीं बोलना है. Just you have to listen and of whatever remarks, whatever thing you have to tell the learners, you have to tell after the that session. So this is most important. Bedside visit is not place for pointing questions and criticism of learners, but most of the teachers will do the criticism in the learners. ये ऐसे करते क्या, ऐसे नहीं करना है actually. Ideally that is the not place for. It will impact on the patient also and learners also. Then the bedside should be placed for positive learning. Positive learning means if students know little something, then you have to give the extra knowledge and you have to appreciate that particular knowledge. That is the positive learning. After the teaching session is concluded, a learner or the teacher should return briefly to see the patient to answer any questions that may arisen as a result of visit, to thank the patient for their time and assistance. सब बेडसाइड क्लिनिक होने के बाद पेशेंट को हम पूछना है, आपको कुछ क्वेश्चन है, क्वेरी है, वो पूछना है, एंड वी शुड थैंक द पेशेंट कोऑपरेशन एंड देयर टाइम एंड असिस्टेंस. दिस इज मोस्ट इंपॉर्टेंट. अदरवाइज नेक्स्ट टाइम आप बेडसाइड गए तो द पेशेंट्स विल सिंपली वॉक अवे. हमारे इंटर्नशिप में होता था, कब क्लिनिकल टाइम के लिए हम आते, सारे पेशेंट बेड से निकाल के जाते. सो पेशेंट शुड फील कंफर्ट. अगर दैट एनवायरनमेंट यू शुड नॉट प्रोवाइड, देन इट इज वेरी डिफिकल्ट इन बेडसाइड टीचिंग. क्लासरूम में हम बच्चों को पकड़ के बोल सकते, लेकिन बेडसाइड टीचिंग क्लिनिकल मेथड एफिशिएंट होना है. The prime focus or prime VIP treatment should be given to the patient, because their comfort is, their support is needed in the bedside clinic. Then rules to be followed while conducting the bedside clinics. Is my voice is clear? Sometimes I am difficult to pronounce. Hello? Whether you are able to understand?
Yes.
Hello?
Yes, sir.
If you see the slides, and a little explanation is also useful, because these are practically you have already done. Just this is the theory behind what you have done, what are the concept behind the clinical methods. So establish rules for conduct bedside presentation. First you have to establish rules for conducting the bedside presentation. तो whatever rules आपको कैसे बिहेव करना है, क्या करना है, क्या नहीं करना है, बिफोर गोइंग टू द बेडसाइड यू हैव टू एस्टैब्लिश रूल्स. वो पहले बताना है बच्चों को और लर्नर्स को. देन इंट्रोड्यूस द पेशेंट्स एंड लर्नर्स अप्रोप्रिएटली. पेशेंट एंड लर्नर्स को इंट्रोड्यूस करना है. ये हमारा इंस्ट्रक्टर का काम रहता है. पेशेंट को बोलना है दीज आर द इंटर्न स्टूडेंट्स, दीज आर द पीजी स्टूडेंट्स. पेशेंट एंड लर्नर्स को इंट्रोड्यूस करना है. देन एंश्योर दैट द सेटिंग ऑफ द रूम इज सुटेबल फॉर द लर्निंग. So learning bedside teaching करने के लिए that particular time place is suitable or not, you should ensure the that. Demonstration appropriate communication techniques and allow the patient to clarify his doubts. Demonstration करने के time, if any doubts comes from the patient side, why you are doing this, so like that, then you have to clarify his doubts. Then teach in the presence of patient. Teach in the presence of patient, then only it is uh, uh, beneficial. Sometimes what happens, आधा बोलने के बाद पेशेंट मेरा ये है वो है बोल के उठ के जाते, so then we can't continue that particular things in the without absence of the patient. That's why it is priorly patient को पूछना है, आपको कुछ ट्रीटमेंट चल रहा है, अभी जाना है, आपको टाइम है, ये सारे चीजें पूछ के ही हमने बेड साइड टीचिंग चालू करा है. अगर हमने आधा बोल के बाद में पेशेंट बोलते हैं नहीं सर मेरा ये प्रोसीजर का टाइम हो गया, so then it will not ideal. So in the presence of patient only the bedside clinic teaching will be effective. So before going to the bedside, you have to make these rules conducting the bedside clinics, then it is more appropriate or ideal. Then be careful about asking the student who is caring for the patient question that they are unable to answer. Agar patients are unable to answer who is caring, so that type of questions, some questions the student should not ask, take care of that things. Find out from the team what portions of the physical examinations or clinical experience give them difficulty, then discuss, demonstrate the property. बच्चों को कौन सा पार्ट डिफिकल्ट लग रहा है उसका बारे में टेक्निक्स को डेमोन्स्ट्रेट करना है. क्लोज बेड साइड प्रेजेंटेशन एंड कंक्लूड द सेशन. सो दिस इज द rules are followed in the bedside clinic. Then case method and case study. This is also one of the other method in the clinical teaching method. So clinical case method and case study serve similar purpose in clinical teaching. They provide simulated case for a student review and critique. So case method में क्या होता है? It is short cases are developed around the actual or hypothetical patient, followed by open-ended questions to encourage the students thinking about the case depending on how case is written. For example, case method में क्या होते हैं? Is one short cases. It may be actual patient भी हो सकता है, hypothetically you can tell that this particular person will have this condition. What is the your diagnosis? So like that you have to give the open-ended questions. So it will help to thinking of student. Open-ended questions are help to students thinking. So there are two type of questions. All of you know open-ended and close-ended. So open-ended questions will leads to the further explanation or explanation. That is the open-ended. Close-ended means if that after answering that particular question, the no further discussion will not happen in the close-ended type of question. That is the open-ended question should be given in the case method. So case method is effective for applying concept and theory to the clinical practice for promoting problem solving, decision making and critical thinking. This method is very useful strategy for helping students to learn how to analyze a case, identify problems and solution, compare possible alternative decision, arrive conclusion and management strategy. It also helps students relating course content to clinical practice, integrating the different concept theories in the particular client situation. So if you see this example, you will understand what is the case method. So see, Miss Sindhu, aged 40 years, is admitted in the emergency department with severe headache, right-sided weakness and aphasia. Her temperature is normal, pulse is 120 per minute, respiration 60 minutes, and blood pressure 180 by 120 mmHg. This is the case method. You are giving the situation. This is maybe real patient condition or it is maybe hypothetical question. This type of case methods. Real patients का भी data दे सकते हैं और hypothetically you can give this type of case method questions. Then you will ask, describe the possible reasons for the symptoms, provide an explanation for your answer. So इतना साल में 40 years में इमरजेंसी डिपार्टमेंट आ गए, राइट साइड वीकनेस है, हेडेक है, अफेजिया है, टेम्परेचर नॉर्मल है, इतना डिटेल्स देने के बाद आपका पॉसिबल रीजंस क्या है ऐसे सिम्टम्स आने के लिए एक्सप्लेनेशन दे दो. देन राइट एडिशनल डाटा would collect on admission. Why this is important for planning the patient's care. This is these type of questions are open-ended. You may elaborate. That is the concept of open-ended question. Some students may write it maybe a stroke. Some will write or other conditions, different situation where this weakness and aphasia and headache will comes, high blood pressure. So based on it will give the thinking in the very openly. It is not close-ended. Someone may write because his blood pressure is high. That's why these type of symptoms are happened. Some patient may tell that because of ischemia also it is possible. So whatever may be the answer, you have to provide an explanation for your answer. Then write additional data. So additional data would you collect on admission? These type of question will make the student thought process, and he will integrate all the knowledge and give the answers in the this type of case methods. This is also clinical method, but here the real patient is not there. You are giving the real patient scenario or hypothetical cases. So what will you do? That type of method we tell that case method. Then case study. So there is some difference between case method and case study. A case study provides an actual patient situation or hypothetical one for student to analyze and arrive at varied discussion decisions. Case studies typically are larger and more comprehensive than the case method. Case method से case study कैसे different है? Larger, longer रहते हैं and comprehensive method, providing background data about patient, family history and other information for more complete picture. Case study में क्या है? Even though we are learn this case study in the learner center method में case study बोल के concept हमने learn किया है. In a journalism एक particular case study देता है. So if you see the recording, you remember. So that same thing. Case studies are longer and in detail data we will provide background data. Then it will help to analyze the and come to the various decision for this particular cases. This is the case study. Individual case, these are the longer than the case method. Case method में उतना ही देते हैं. ये 40 years का मैन था, इनको ये हो गया, इनका ब्लड प्रेशर इतना इतना है. That is the short one. What you think about this? But in case study, you will provide more data, background data, and more information about that particular case. Then you will given for the analyze the case studies. The student can analyze case studies in greater depth than the केस मेथड. केस मेथड में ज्यादा डेप्थ जाने को नहीं होता है आपको. द डेटा इज वेरी लिमिटेड, बट इन केस स्टडी द डेटा इज मोर. यू कैन गो इन डिटेल एंड प्रेजेंट मोर डिटेल rationale for their analysis. In case study, students can describe the concept and theories rationale that to be guided their analysis, how they use them, understanding the case and the literature they reviewed. So longer than the case method. If you see the example, you will understand. For example of case study, see the situation. Vimala, 44 years old, is seen in the physician's office with harshness of voice and has a slight cough. During the assessment, she tells the nurse that she also has shortness of breath, particularly when walking fast and going up the stairs. Then she has never smoked. Vital signs are one BP is 120/80, pulse 80/80, respiration, temperature. Vimala is married with 2 teenage daughters. She works part-time as a substitute teacher. She has always been health conscious, watching her weight, eating properly. She tells the nurse how worried she is because she has read about the woman getting lung cancer. Even if they are never smoked, the physician orders to combine a PET and CT scan. So this is the case study. In detail data should be given. Then they will ask, explain the meaning of PT and this CT scan, why it is ordered to the Vimala. So then the learners should analyze based on these data why this CT scan is advised for this. Their physician may suspecting the cancer. So everything you can interpret from this detailed data. Then describe how will you explain the Vimala's about procedure to prepare the her scan. Then after a few weeks, Vimala diagnosed with the adenocarcinoma of lung. Then describe the various treatment used for this type of cancer. Select one of the treatment, explain about the same. Describe the standard nursing care for patient receiving it. Add data about Vimala and her family in case study. So this case study is a very longer and deeper in the compared to this case method. So case study is a for longer period. So what resources are available in your community for Vimala? Then it is now 3 months after initial diagnosis. Finish this case study by describing the Vimala's condition and your nursing care for her. So or your treatment for her. This is taken example from nursing textbook. So they are given nursing for her. For example, in detail, if I given other situation related to our Ayurveda, then this type of question if you are giving, then that is case study. So usually in some exams, these type of questions they will ask, especially for medical officer post. So one CCRS का एक डिफेंस में मेडिकल ऑफिसर का कंसल्टेंट का एग्जाम में ऐसे क्वेश्चंस पूछा था. They will give this some situation. Vimala is 40 years. She is have this particular condition. They are planning for this Panchakarma Vamana. So they may give the different situation. That is the case method. Then if you are having the detailed data and if you are taking that case for a longer time, that is case study. You have to remember difference between case method and case study. All of you understood? Even though they look similar, but they are different. Case method and case study. All of you understood what is case method and case study?
Yes, sir.
Yes.
Then one of the clinical methods, bedside clinic हो गया, case methods हो गए, case study हो गया, then nursing care plans. So caring of the patients, how do only treatment is not a part of hospitalization. The care should be taken for patients. So what are the plan of care, their food, their other things. So the nursing care should be also is a part of clinical methods. Usually it is for nursing students, and some teaching should be also for our to us also, because in particular we should know what are the other things the patient should provide. So everything you should know also, but majorly this nursing care plan will be done in the nursing education, but it is also clinical method. So nursing education में ज़्यादा in detail study होता है इसका. Then demonstration. So what is demonstration? Demonstration is a visualized explanation of an important fact, idea or process. Though students have learned all the procedures, re-demonstrated and practiced with supervision, it may be necessary to reinforce the technique in the real situation. अगर आपने बच्चों को बस्ती देना टीच किया है, बच्चों को बस्ती देने के लिए भी आता है, बच्चे सीख भी गए, फिर भी कभी कभी क्या होता है, reinforcement that particular patient conditions you have to demonstrate giving that basti in the real situation. So that अगर आपने हेल्थी पर्सन में दिया, कुछ डेमो दिया, कुछ एक्सप्लेनेशन दिया, even though the learners know, in real situation you have to do and do that thing and demonstrate the learners. That is the reinforcement of technique is called as a real demonstration. Visualize the explanation of important fact. If that is important procedures, important thing के लिए आप और एक बार करके उसका बारे में एक्सप्लेनेशन करते हैं, that is the demonstration. Important fact, idea, process को हमने रीइंफोर्स और रियल सिचुएशन में करके बच्चों को उसका बारे में बताते, दैट इज द डेमोन्स्ट्रेशन. डेमोन्स्ट्रेशन इज आल्सो important or one of the method in the clinical teaching. If you may demonstrate world come in other places also, if you may demonstrate on the models also, but here in clinical teaching it should be in the real situation, not on the models or dummy particles articles. So it in the real situation. So if you are teaching suturing in the models is different, but demonstration in the clinical method is in the real situation. Really the patient has cut wound, then if you are doing the suturing and teaching, that is the demonstration in clinical method. In demonstration in clinical skill labs और theory classes में आप कुछ मॉडल रख के उसको भी सिखा सकते हैं, that is also demonstration. But clinical methods में क्या different है, real situation should be there, real patient should be there, that is the demonstration in the meaning in the context of clinical method. Then clinical supervisor should identify the need for demonstration or the procedure, either individual or groups. Patient care technique procedures are demonstrated while providing care to the patient away from bedside, individually or group. So based on the individual need or group, the demonstrator should give the demonstration. That is the concept of demonstration. So these are the different methods in the clinical methods and other clinical methods. As I told, we have discussed about demonstration, but these things I can simply explain. No need of notes also, you already know ward rounds. Usually we will do the ward rounds, that is also clinical method of teaching. हम physician के पीछे जाते हैं, what he will ask, what he will do, what he will tell, we will note. So ward rounds is also method of clinical teaching. Then बेडसाइड क्लिनिक से इससे थोड़ा डिफरेंट होते हैं वार्ड राउंड से. इसमें वार्ड राउंड्स में एक्टिवली वो बताना है, ऑलरेडी यू आर ओनली ऑब्जर्विंग द फिजिशियन मेजरली, बट बेडसाइड में इंटेंशनली आपको सिखाने के लिए लेके जाता है. बट वार्ड राउंड्स इज आल्सो मेथड ऑफ क्लिनिकल टीचिंग. देन लॉग बुक का मतलब है ये स्टूडेंट्स के लिए, लर्नर्स के लिए क्या क्या सिखाया आज, क्या क्या ऑब्जर्व किया, वो सारी चीजें लिखना पड़ता है लर्नर्स को और इंटर्न्स को. दैट इज द कॉन्सेप्ट ऑफ लॉग बुक. हियर इन इंडिया वी डोंट सीन, फॉरेन में हो सकता है ये लॉग बुक का इन द इंटर्नशिप में प्रैक्टिकल लॉग बुक प्रैक्टिकल क्लासेस में हम यूज करते हैं, पीजी में यूज करते हैं, लेकिन क्लिनिकल टीचिंग में व्हाट वी हैव ऑब्जर्व्ड, व्हाट वी हैव डन टुडे. सो आई हैव नॉट सीन लॉग बुक इन द क्लिनिकल बेडसाइड. नोट्स रहते हैं टुडे व्हाट वी कंडक्टेड, व्हिच पेशेंट. सो but everywhere this based on logbook also, it is also one of the method. And drug file, what are the drugs should be given to the patient, the detailed description of drug. So this related to pharma students. And records and reports, seeing the records and reports of the patient and everything, that is also clinical method. But important methods what we come with, this bedside clinical case method, case study and demonstration. Up to this we will understand, and these you have to remember, these are also methods of clinical types or other methods of the clinical teaching. So up to this all of you understood? Any doubt?
Yes, sir.
Hello, all of you aware and all of you know about every concept of this bedside clinic. Just behind the concept, theory concept, you don't know. So that's why they have added this point in the teaching methodology concept, that is bedside or clinical teaching. With this, the teaching aptitude, the unit 1 is completed. So from next class, we will start with the education psychology or communication. Any doubt up to this?
No, sir.
Okay.
No, sir.